Alder's ePortfolio for preparing for Fieldwork Level 2 as well as the NBCOT exam. I first started off with information about the OTPF and frames of references. I thought this was important because when beginning OT school, the OTPF was the first thing that we were introduced to, and we continually use it throughout the program, and I intend to use it as a clinician. It's our guide for our profession and is updated every 2 years and has the best information available to us. So this information is also coming from SAMES, which is a professional reasoning textbook. I like these images that I have here to understand patience and collaboration needed, that OT process, evaluation, intervention, and target outcomes. These are some specific occupational therapy terms. And here are some more diagrams that I think will be important for me to just brush up on the specifics of occupational performance and participation in individuals. And up here, we have focus on environment, context, performance, all things to consider when treating a patient or client. So then I have the information about the certification of a OTR, and this will be helpful when preparing for the NBCOT to understand what information I'm required to know, as well as the format it will be presented in when tested. It is a 4-hour exam and involves a lot of different topics, so this is helpful in organization and preparation. And here again are some procedures and application process and things needed on the exam day. These are some things to consider when and where to be to take my exam, along with when you enter and while you're taking your exam, if you're allowed to exit or not, to use the bathroom, and the process of getting fingerprinted back in. Strategies are here, which is going to be really important for me as I'm an overthinker. And along with completion of the exam, when to expect your results back, and that whole process to earning my R. So then I went in to the information about goal writing, which we have focused a lot about throughout the program and is so important. And here are just some very common formats that I think will be helpful to reference, since each setting focuses on a different or prefers a different type of goal format. So if I show up to my level 2 fieldwork day 1 and they say that they're going to be using the Roomba format, this is something that we haven't used consistently throughout the program, so I can easily pull this up and brush up on this format, and so the next day I'll be prepared for my fieldwork. Here's another image along. And then these are some very useful goal writing tips if I'm having some blockage or not sure what I should be discussing in documentation. Here are some good action verbs, some verbs to avoid in case of insurance issues, approval, and then just some review from classes that we have had. The basics between long-term and short-term goals, and then this is important, the 6 types of goal direction. So I can remember that depending on my setting. If I am in inpatient rehab, I will most likely be focusing on restorative. If I am in EI, I'll be in habilitative. Maybe the older adult population modification of the home, and the others listed here. And here's an image up here that's helpful just to put in another format for my reference. So this is the next one. I got a little ahead of myself, but this is what I have next that I figured was important. This is going to be great in many settings, as in fieldwork, and we're all required to have a physical dysfunction rotation, so this will all be applied then. And then also just as a clinician, remembering these very basic steps in evaluation along with reevaluation throughout the process. So physically, we want to assess their strength, endurance, edema, and range of motion. Also, along with these concept maps, I also have my videos that we've recorded. We did the first semester, and then we did a comprehensive video this last semester that has everything included, from upper extremity range of motions and manual muscle testing, along with range of motion and manual muscle testing of the wrist and hand, and edema measurements. We haven't done a lot of hands-on experience with edema because it's hard to simulate, and we haven't had a lot of in-person fieldwork. So I will definitely be referencing that, especially if a site has a volumeter, that's something that I've not seen or used before. So this will be helpful to reference. Then this is going to be discussing learning. So how, as OTs, we understand the stages of learning. I think this will be beneficial. My first Fieldwork 2 rotation is in outpatient pediatrics, so they're really in that developmental stage of cognition and habilitative and learning all of these new skills. They are in that direct learning process, so this is going to be very, very vital. Next, Radomski is going to be something that I will probably, if I didn't have these concept maps, I would be taking the book with me to clinics. Of course, I'll be using the book probably while I'm studying for the NBCOT, and using this as some supplemental material and kind of review, but I'm glad that I have these concept maps, so I can just take my computer and I can open these files up and reference them at my lunch break while documenting, instead of having to lug the whole Radomski book along with me. So when I'm discussing or figuring out analysis of the observations that I've seen throughout the day, some ideas of how to adapt environments and contexts for patients. There's also some of these good graphics, and also understanding like grading up and down if I am in field work and need help with ideas of how I should gauge activities. This is going to be a great source. Then just another great resource for teaching and how our patients and clients learn. This is something, again, since we've not had a lot of hands-on one-to-one experience, it's going to be good to reference so that I can remember that there are these phases of learning, to be patient throughout the process, remembering to identify meaningful activities. So whether it's in an NBCOT test question, making sure I'm answering with a client-centered approach, or applying this to practice. Then we are going to move on to the different foundational reviews of the systems of the body. So first is the cognitive performance. And here it's rehabilitative. So for strokes and other neuro incidents, how to teach skill task habit training, this is going to be beneficial for me in my second Fieldwork 2 rotation, since I am going to be in a hospital. I'm going to be in acute and possibly inpatient rehab, and maybe some outpatient. So being along with patients in that process of retraining and adapting, different approaches that I can take to reference and also to be aware of when studying for the NBCOT, and of course remembering my clinical reasoning. Okay, so this is just again addressing cognition and assessments that I can reference when drawing a blank, or different operations of cognition. So I need to be observing and assessing orientation, attention, memory, executive abilities, self awareness in any setting that I'm in. Okay, and then we are going to be assessing vision next. I have some assessments here that I can easily reference if I'm seeing in my chart that I'm going to have a patient that may have some deficits in vision. I can easily reference these top reliable assessments. And then here are just common deficits in vision to brush up on and review. Understanding the functions of the eye, physiological, and attention. So how it's all integrated. This is focused on visual processing and adaptations, skill training, and again, just a great resource for studying and practicing in my level 2 rotations. These images are going to be really helpful to not only just understand what's going on physiologically, but also what that patient is experiencing and seeing. This is specific to brain injury, which is going to be common. As we can see, it's very complex. And this will be a tool for me in acute setting or inpatient rehab. Next of the foundations is experiencing sensation, signs and symptoms to be aware of, to know that this is an actual sensation deficit, not behavioral, not motoric. And this is going to be beneficial especially in the peds, where I talked to my CI and she said there's going to be a lot of children with autism and they experience a lot of sensation difficulties. And then lastly is motor planning and performance. So we have all of these areas. Again, assessments, evaluation, approaches, just like all the other sections that we have looked at previously. So in summary, I will be utilizing these concept maps to just have ease of access of information throughout my fieldworks. They're right at my fingertips of my computer, and along with studying for the NPCOT, this is going to be a great review tool and just guidance and overall information that I'm going to need to learn to be successful in, or review, in passing the NPCOT exam.